Hi, okay. My name is Teresa Palmer. I'm a mostly retired MD geriatrician and family doctor. I grew up in San Francisco, and the board suggested, the Great Panthers board suggested doing a program on Laguna Honda today because it touches on so many issues. For one thing, none of us are getting any younger. And if we need a nursing home, we'd like to stay in San Francisco. I worked at Laguna Honda from 1989 to 2004, and I have deep feelings about how important this facility is to San Francisco. I have asked my former colleague at Laguna Honda, Dr. Derek Kerr, to speak. He ran a hospice program there, which became an international model. Also, I have asked Dr. Sasha Cutler, a PhD nurse and activist and San Francisco union leader, to give his point of view. You all likely know that not only Laguna Honda, but the whole way nursing homes are funded and operated in the United States is a huge problem. A problem that was unmasked by the COVID epidemic, but existed well before it. This touches on all the issues related to how we care for the most vulnerable and poor among us. It unmasked a society that does not value the aged and disabled. Another issue is that in all nursing homes, payroll is the biggest expense. Laguna Honda, like others, made efforts to save money by overly lean staffing. This approach requires a nursing home management who has little sympathy with direct caregivers and is dangerous for residents. And it's pretty ubiquitous. Now about Laguna Honda itself. In 1999, a huge city bond issue was passed to bring Laguna Honda Hospital up to date, to rebuild it. Laguna Honda was described as a place where any San Franciscan who truly needed a nursing home could go. And as the bond passed by a big majority, at the same time, many nursing home and psychiatric beds were being shut down in the city. Private hospitals could not make a sufficient profit on these services and preferred short-stay acute care. So-called nonprofit or public sector hospitals did not want to strain their budgets. After the bond issue for Laguna Honda was safely passed, the director of public health announced to all of us, Laguna Honda is not an old age home. Dr. Mitch Katz announced that a new model of social care for the urban poor would be initiated at Laguna Honda. This was a bait and switch for the people of San Francisco who had paid to rebuild a nursing home that they themselves might someday inhabit. Legally, however, Laguna Honda is and has remained a skilled nursing facility with a small attached acute hospital. The regulations are that to be eligible for nursing home care, one must have a medical diagnosis, and that diagnosis must be primary, and one must need skilled nursing attention. Laguna Honda is not a mental health facility. A new emphasis on behavioral care at Laguna Honda was a way to save money for the general fund. San Francisco General could empty its beds more efficiently when patients with complex behavioral and substance use issues were given priority at Laguna Honda. This was an efficient use of general fund money that both facilities used. The independence of medical and nursing management at Laguna Honda to decide who could safely stay at the facility was, for all practical purposes, removed. Nursing management became an adjunct of San Francisco General, as did the management of the medical staff. The future of Laguna Honda has now been jeopardized by the chaos that ensued from these decisions. The mayor and public health are minimizing the violations as if the nursing home run by the city with a big heart is being persecuted by the federal government. Okay, I'm done. The next speaker will be Dr. Kerr.
I worked at Laguna Honda for 20 years, 1989 to 2010. I now write for the West Side Observer And I've written several articles about Laguna Honda with a slightly different perspective than what you see in the Chronicle and the mainstream press. I think it would be easier for me to answer questions. There's so much I can discuss. I agree with Terry's background statement. I should emphasize that according to the California Health and Safety Code, every hospital must have a medical staff that determine its patient care policies. And one of the contentious issues during the FLOW project was that the autonomy of Laguna Honda's medical staff was subverted. And the Mitch Katz, the DPH director, sort of took over the admissions process, even though the medical staff opposed the admission of dangerous or violent patients coming from San Francisco General. And the reason that the General was so intent on getting those patients out is that their coverage by Medi-Cal, Medicare insurance is limited. You get paid for the treatment of the pneumonia. And after 7 days, say, the payment stops. So the hospital has to discharge these patients in order to bring in a new patient who will bring in revenue. But some of these folks on the medical units at the General and in the psychiatric ward at the General could not be easily discharged. Some were still mentally or physically unstable. Some didn't have a supportive home environment to look after them. Some were homeless. So they wanted to just send them to Laguna Honda. That's fine, but we, by law, are required to only admit those patients for whom we can provide adequate care. And there were some patients that Laguna Honda just could not manage due to violence, endangering themselves and others, etc. And the Department of Public Health wouldn't hear of it. They just rolled over us. And that's what led to a lawsuit that Michael Lyon was the complainant. And once that lawsuit was filed, the DPH backed off. Then Mitch Katz, the DPH director, fired the Laguna Honda CEO, got rid of the COO, the medical director was fired, the nursing director was replaced, and the admissions coordinator was replaced by somebody from San Francisco General. So it was a takeover, an invasion of the hospital. The mayor at the time was Newsom, had to reverse the FLOW project because there's so much controversy and so much public opposition. But the FLOW project continued in a more subtle way. That led to a ballot initiative. Members of the staff and community members did a ballot initiative that would prohibit the admission of dangerous patients to Laguna Honda. That ballot initiative failed. I think it only got about 30% of the vote. And since then, this FLOW project has mutated, has changed, but it still continues to be for the financial benefit of San Francisco General to get their patients out and into Laguna Honda. And if Laguna Honda resists, they know that heads will roll, because that's what happened back in 2005 and 6. So I think that this is really the root of the problem, the forced admission of patients that can't really be adequately managed. So either Laguna Honda has to develop a new program, a new paradigm, or they have to find another place for these hard to manage patients. They have to create another program. The problem in all of this is if we are held subject to San Francisco General's population, then Laguna Honda cannot admit patients from other hospitals, from other neighborhoods. And San Francisco General has a catchment area and it has a specific population. So what happened with the Flow project is that patients from St. Mary's, St. Luke's, Chinese Hospital, UC, all the other places were not getting in. Only San Francisco General patients were coming in. As a result, the elderly started to decline at Laguna Honda. The patient became younger. Women were no longer being admitted in the same numbers. Laguna Honda always had 54% female population. Now it's 37%, the lowest ever. Chinese patients from Chinese Hospital were no longer coming in. So there's an equity issue by serving the financial needs and the clinical needs at the General, where actually those patients are displacing others that used to come to Laguna Honda. And those others are tax-paying individuals who paid for the hospital, but they don't come in. So I'll stop there. I just wanted to raise that point.
Okay, Sasha, would you like to begin?
Oh, yes. Hi, everybody. I'm Sasha Cutler. I'm a nurse and I'm newly retired from working at San Francisco General off and on for too many years, starting out in 1987. And I've just retired after spending a couple of years at Laguna Honda in the old buildings where they had the call center. I was an advice nurse, and my advice is don't get sick. No. Anyway, I wanted to thank everybody. I know some of you, and I also want to make sure that that people recognize that Derek, Dr. Kerr, and others have paid a great price for speaking up, and I'm included in that as well. Just to introduce myself, you can see my background, perhaps. If I step away, that's me in drag there as an old school nurse putting tape over Zuckerberg's name on San Francisco General Hospital.
Good.
This is relevant to what's going on now because
I'm gonna watch this for an hour and then we can go.
Oh, I'm sorry, somebody needs to be muted, I guess. Anyway, so an important part of that background is that even though everybody, including administration, told me that they felt awkward about the renaming of it, the fact is that the Board of Supervisors unanimously agreed to this plan, and then have been reluctant to remove Zuckerberg's name because he gave money to the hospital. And the thing that I'm quite concerned about is the fact that the Muni bond didn't pass, is my understanding, means that the city's voters are running out of patience with the mismanagement of public funds. And I believe that that's part of the problem that we have now that's going on at Laguna Honda. They're going to be spending millions of dollars now to bring in consultants, private consultants, and they do that frequently without listening to the people that do the work. And then when people speak up, such as Dr. Kerr, they are then forced out, and such as myself. I was forced out of the hospital because I was being retaliated against for speaking up about Zuckerberg's, Facebook's monstrosity and the invasion of privacy. When I arrived at Laguna Honda, I got there just in time for the epidemic, And we were told at one point I was assigned to go out and do testing of the first people that had this coronavirus disease, and they were teaching us to do things incorrectly, such as when going to the patient's home, we were instructed to not put on our protective equipment until we were inside their home to avoid a problem of the people seeing that somebody's coming into their home wearing protective equipment. I said, I will not do that, and I will be respectful, and it worked out fine. And then they removed me from that after I arranged for a meeting to happen with the union there. They said, we don't need you anymore for this. We're not going to have you do it because I complained about something being done wrong. So the crux of the problem and then at Laguna Honda, while I was there, they moved us into an unventilated area, and in the lunchroom there, at first they had people sitting eating food 3 feet apart from each other, until I said, that's not a good idea. It needs to be one person at a time. And they said, okay, we'll tell everybody that. And then I said, and the sign that says, keep the window closed at all times in an unventilated room where people are eating is not a good idea. So I said, please take that sign down. And they refused. They refused any meaningful changes to the facility. And they told me when I made a complaint to Cal OSHA about it, they said, oh, it's an old building. We can't do anything about it. And I said, we can open the windows. It's not rocket science to do some of these infection control things. And they said, we are guests of Laguna Honda here. And I said, aren't we all the Department of Public Health? What are you talking about? So it's, to me, the crux of the problem that I see, because I wasn't inside in the skilled nursing facility part of Laguna Honda, is that there's no desire to listen to and communicate and try to make things better. The other thing that happened upon my arrival there was the fact that the worst patient abuse scandal that I'm aware of anywhere had occurred recently. And the response from the Department of Public Health was, in addition to getting sued, was to try to minimize how bad it was, and to say, oh, well, we've removed the CEO. And then it turns out they did not remove the CEO. They sent her to San Francisco General Hospital, created a position for her. And there were people that I worked with at the hospital that didn't want to, they said, I better not run into her because I'm not going to be able to control myself for what she did in overseeing this abuse. And this abuse that she did nothing about, and claimed not to know anything about it, but was completely, supposedly completely innocent. This was, I think it was 10 years after she had been accused by Dr. Kerr of having stolen money from a patient care fund.
Veras Domingo.
Sorry about that. Go ahead, Sasha.
That's all right. Anyway, so I want to get to my ideas about things to be done, because I think Art Persico is correct. We need to have some ideas about what to do. So here's some ideas that I have. One is from a sister local of SEIU, when they were faced with the bullying and the mismanagement and terrible abuse of frontline staff at a hospital in Los Angeles. They demanded a listening session where they had their director had to just sit there and listen to all the terrible things that had happened to people from the staff. And it resulted, I was told, the local was happy with the fact that there was some accountability, and some managers, some of the worst managers, were terminated. They weren't just moved around. So that would be one thing to ask for, is to have that kind of transparency. And the other thing is to stop hiding behind patient privacy or infection control, and let more people in rather than lock it down unnecessarily. When I wanted to have a vaccine demonstration where I would give the vaccine to the administrator that I hated the most, and they would give me a vaccine also, just to show that we're with public health, we need to put stuff aside and do things better. The other thing that I would encourage is to have a debate, to actually have a debate, to have somebody get up there and represent the other side and say, oh, we think it's going to be fine if we do blah, blah, blah. And then have that and have it as a formal thing, because people pretend that they agree with each other even when they don't. I also think that we need to have nurses on the Health Commission. Right now, there's 0 on the Health Commission, and I think the Health Commission is pretty much a toothless body, but something needs to be done about that, I think, so that they're actually doing something to oversee the situation and make recommendations to make things better. So we need to keep Laguna Honda open, and we need to hear from more people, not just to have it be us whistleblowers. We need to hear from people what it's really like and what's going on, and to get the services in there for people, give the people the training to try to help all the people with this terrible opiate overdose epidemic, and open the windows, for heaven's sakes. There's things that we can do, and stop punishing people for speaking out and just trying to be part of the solution. Thank you.
I just wanted to give 5 minutes for points of clarification before we open it up to questions. And Derek, one point I'd like to make is the other thing we can do is to have better city regulations about protecting whistleblowers. I was in that position, Derek was in that position, you were in that particular, it's why Derek and I left. I left before I got into, I formally got into trouble, but it was coming. There is no protection from retaliation if you speak truth, the truth to power in the city. Also, Derek, could you clarify what the Flow Project is?
It's a system designed to maximize the speed and efficiency of getting patients out of San Francisco General and into Laguna Honda. San Francisco General has priority, and they kind of determine who's ready for Laguna Honda, rather than Laguna Honda determining which patients they can handle. And so it's a one-way flow, and any kind of screening process or assessment of the patients is frowned upon because it slows down flow. It's gone through many transmutations over the years. It was extremely heavy-handed back in the 2004-2005 era, and now it's just part of the culture. And there's less violent patients. They still have an enormous number of altercations at Laguna Honda, patients fighting amongst themselves, stealing from each other, etc., but not nearly like it used to be. Now the problem is patients with intractable drug habits, substance abuse disorder, that the hospital cannot manage. And when the inspectors came in, they found that a psychiatrist was interviewing a patient, and the patient was smoking fentanyl during the interview. And the patient said, oh, they know about it. They know I'm doing this. The psychiatrist reported it. They had to monitor the patient to make sure he wouldn't overdose. But the inspectors thought this isn't good. They interviewed a director of nursing, and she said, our team has exhausted all its options. We don't know what to do with these patients. We search them, we monitor them, and they still smuggle in drugs and paraphernalia. We can't deal with it. So the inspector said the hospital is incapable of dealing with these patients, and therefore that's a deficiency. They're bringing in patients that they cannot manage. So that's the problem with the Flow Project. It emphasizes flow of patients out of the general without having sufficient screening procedures like we used to have. We used to have an admissions screening committee. Their patients would be evaluated for suitability. That committee is gone, and now they have a patient flow committee. The emphasis is on bringing them in rather than assessing them for safety. And I think that's why Laguna Honda got into trouble.
I can just tell you the experience of patient flow at San Francisco General Hospital while I was there. That was the emphasis, and the emphasis was on speed. They wanted to get people out of the hospital as fast as possible, and they played the hospital against Laguna Honda. And they also, if bad things are going to happen, they want it to happen not on the hospital's license, but somewhere else. And another example of that was, it's well known that there was a woman whose body was found in a stairwell. I don't remember the year, but there was that problem happened, and there was a lot of news about it. But then a few years later, a woman from the mental health rehab facility that's located there at the hospital, she wandered away and was found in one of the steam tunnels. She was found later on dead there. There was less news about her, in part because she was mentally ill, and in part because she was old, and in part because she was Black. There was, in my opinion. And then the other problem is that the CEO of San Francisco General Hospital made a point of saying, you're going to hear this terrible thing happening about this terrible thing that happened. It did not happen at San Francisco General Hospital, she said. Why? Because it wasn't on the hospital's license. She was on the grounds of the hospital for another facility under another license. And to me, that is emblematic of what's going on, where they want to move things around and pretend that there's impunity and that there's nothing we can do about anything because it's somebody else's problem. And that's the thing that needs to be fixed. In addition to the culture of silence, is to stop trying to put the problem off to somebody else.
I'm going to turn this over to Art to run the Q&A. He's better about seeing hands up than I am.
Okay, thank you.
But
Thank
if
you,
someone
Claire.
is being ignored, speak up.
Yeah, Michael Lyon will be assisting me in noticing if your hand is up. So please raise your hand using your physical hand or the reaction button. Click on the reaction button and you choose raise hand, and then lower it when you're done. Okay, lost it for a minute.
Karen.
Yeah, Karen's first. Thank you.
Thanks. Yeah, these are all issues. The meeting today is saving Laguna Honda. And so I think that means that the particular problems that they're facing right now need to be laid out. And we need to hear what the plans are. How is Laguna Honda going to be saved? Can it be saved? What's going to happen to all of the residents and future residents?
Well, if I may mention, Laguna Honda has hired 2 consultants for $5.5 million for the 2, and they will help Laguna Honda to get recertified, which it must do in order to continue. Right now, it can't admit any new patients because it's decertified. So we have to wait for the consultants, what they're saying. I did see one of the consultants' initial reports, and the consultant said that Laguna Honda could not pass the recertification exam at this time, and it needs to do, a great deal of sort of improvements. So we're kind of stuck. We have to wait for the consultants, and they're going to implement these recommendations, and then CMS, the federal regulators are going to come in and do a survey. And if Laguna Honda passes that survey, then they'll come back in 3 to 4 months to make sure that those fixes are long lasting. And then by January of 2023, Laguna Honda should be good to go. If they fail the survey after all of the consultants have put in their recommendations, then I don't know what's going to happen. My guess is that the CMS, the feds, will be lenient, will be flexible, because they know that 700 patients cannot be placed. There is no place for them. They're all on Medi-Cal. The reimbursement rates are low. Private nursing homes don't want these kinds of patients. Many of them have complicated medical needs. So what they'll realize is that Laguna Honda has done its best. They've discharged 20 patients, and then they're going to, survey them and recertify them. And they're getting all kinds of pressure, as you know, from Nancy Pelosi and Dianne Feinstein and Newsom, the mayor. So there's a lot of political pressure. And the head of CMS is Xavier Becerra, who used to be the Attorney General for San Francisco, from California. So he's sort of connected with California and with the Bay Area. So my guess is that there'll be behind the scenes negotiations to get this fixed.
I can add that I know that my union, SEIU 10-1, is for the first time in many years is saying we want to help administration despite the bad experiences that we've had in working with administration, because we have to keep it open. So there is going to be a lot of political pressure, as well as worker pressure on the government to do something about this. It would be a huge embarrassment to our representatives, both locally as well as nationally, should they close I believe the largest public nursing home in the country, or at least west of the Mississippi. So it would be a tragedy, and I suggest that people look at what was done when I got to work on the AIDS unit at San Francisco General Hospital, and I really encourage people, if they want to see me, I'm in the movie about it. You can see what I look like in 1987. But more importantly, one of the things that I learned was that unit was established despite the fact that there were people who were members of the union that didn't want to take care of people with HIV/AIDS because they were afraid or homophobic. And the union worked with management and said, you know what? If you don't want to take care of people, that's too bad. You better get another job. And that's not something unions do frequently, because we're trying to represent what everybody wants and needs. But in this case, everybody wants and needs the hospital to remain open, and we want there to be accountability when people do bad stuff. The people that were taking pictures of patients and then encouraging patients to do terrible things to each other and sexually harassing, those were union members, but I cannot support that. I'm not willing to be silent when there's something that's going on that is awful. So we need to do something about that, to open up the place to people that have good ideas about how to do things, because most of the people that work there, you'll be less than surprised to know, are wonderful people. And there's wonderful things we need to get back to. Dr. Kerr put up this hospice. That was something amazing. It's a worldwide thing. So we need to get back to that.
Okay, Terry, do you have anything to add before we go to our next question?
Yeah, I think one of the things is if there was really an honest discussion about this, and the media can help, if there's really an honest discussion about how this came to pass, it's possible that the Department of Health and the city could learn from their mistakes. And that also, if you get the inappropriate folks that can't be safely managed out of Laguna Honda, you would have more beds for elderly people so they wouldn't have to go out of county to find nursing homes. Also, you need less bureaucratic inertia, so the people that really don't need to be in Laguna Honda don't get discharged to shelters of the street, but they get discharged to stable housing, which is a problem for everyone with marginal or unhoused in San Francisco. But discharges from both San Francisco General and Laguna Honda to the street or shelters are unacceptable. What are the social workers there for? What is the system there for?
Okay, thank you.
Leah had her hand
We
up
have-
for a while.
Leah put her hand down unless she wants to raise it again. In the meantime, there's a question from David Elliott Lewis about the timeline. When is Laguna supposed to be closing? What kind of deadline is Laguna Honda up against to avoid permanent closure? Right now, it's threatened. It's temporarily having to get rid of all of its patient population. But what?
There's Derek, there's a 4-month plus a 2-month extension, right?
Well, yeah, CMS has agreed to keep paying for another 4 months as long as Laguna Honda proceeds with its closure, transfer, and relocation plan, which is required by law. They have to do that.
Oh, sorry.
So we've got 4 months, and it all depends on when Laguna Honda is ready to apply for recertification. They have to apply to CMS, and then CMS comes in and investigates them.
Thank you. Leah, do you want to ask a question or make a comment or both?
Yeah, I want to ask a question. One is,
What do you have on your head?
oh, I have a skylight and it's so bright, so I need something. So, my question is about, first, what can we do as a community to support that Laguna Honda stay open? And also, what would be the plan on making, a transition so people that don't need to stay there can be incorporated into the community? And another thing is, I'm sorry, but I felt a little bit conflicted when people were talking about who deserves to go there and who doesn't deserve to go there. And maybe I misunderstood, but I was just like, are we already like, making some kind of racial, distinctions, or what kind of distinctions is this, and I understand that you were talking about people that have other type of, issues, other problems, but I was just concerned about it when I heard it. So yeah, thank you.
Michael, did you want to comment on Leah's question before it gets answered? Or do you want to wait for your own question?
No, I was hoping Terry would talk about the lack of how much of this problem is because of the lack of services for people with mental illness and drug use, and how this has been a continuing.
Yeah,
problem.
one of the things that we know that we don't have disability-friendly substance use treatment treatment for even unhoused elders and disabilities. There are things like in-home support services workers can't get into navigation centers. There was a big argument about the SRO owners putting even safety bars in bathrooms, in showers. And so what you get to a certain level of disability, even if you wouldn't normally be eligible for a nursing home, and there's nowhere else to put you. where you can safely live, even though you really, your case isn't medically bad enough to be in a nursing home. There's a lack of services, which generally we call long-term supports and services. And we especially have problems with unhoused elders, disabled or no, substance using or no. Basically, once you're an unhoused elder, you're just, excuse my language, shit out of luck. And Alan Cooper and Allegra Fortunati have done some work on this and have done a presentation to us about this. But it is, I mean, everything is related to everyone else in this town. There's a lot of shifting around to kind of save money. And so it's not just like Sasha, if it's not on my place, I can move it to somewhere else. And then the mayor said, well, we're going to have a 10% budget cut across the board. And that just makes everything worse. It isn't looking at where the need is individually. Okay, I hope I answered the question.
Lygia, did you feel your question was answered there? I think you were alluding to people who are poor or racial minorities not getting a priority in this situation. Was that correct? And
well, I'm not sure, what was the comment about, who they were talking about when they said people that deserve to be there or people that don't deserve to be there.
Yeah, I think you're talking about making a moral judgment about the source of a disability rather than just getting someone what they need. Derek, do you think you could address that?
Well, Laguna Honda is stuck because there's laws and regulations about, and it has a license to only admit certain kinds of patients. They have to have skilled nursing needs, certain kind of medical needs. They cannot be simply psychiatric patients. They can't be pediatrics. They don't take anybody that's under 16 years old. So there's all these laws. And if Laguna Honda opens up and brings in patients that they can't really care for, then the regulators will come and pull their license away or decertify them. And that's what's happening, I think.
I guess it's about the way that you were saying it about deserving that, made me wonder what was this referring about, and because, in the city, we have problems like Terry was talking about, all the problems that we have with not having enough services. But the other question was about, if there's going to be a plan, like if we can really stop the closing, because transferring for these people can be fatal, right, for some of them. And so if we can stop the closing and if there is a plan that have been contemplated to transition those who could be reincorporated into their communities, how can that happen, that transition?
okay,
Too many patients. You've got 700 patients. You can't incorporate them into the community at present. So what we need is a new mental health program that can take care of these patients that Laguna Honda is struggling with. And you need, more housing, more services in the community. But right now, the only way to save Laguna Honda is for Laguna Honda to save itself. It has to.
Yeah, I'd like to make a comment and ask a question. It seems to me that since the state mental hospitals were closed, we are struggling over where mentally ill people can be treated. The promise was made to treat mentally ill people in the counties, in the communities, but that promise, I think, has been broken. San Francisco has a shortage of psychiatric beds and a shortage of mental health treatment services. It always gets the short end of the stick when compared to physical health needs and physical illness. So are we in effect, are we fighting each other over a scarcity of resources caused by the failure of our state mental health system and our counties to hand off the mental health treatment part of this thing that happened, started with Ronald Reagan shutting down mental hospitals along with the patients' rights movement. So we also have to talk about that and how can we stave off this closure? What can we do to help stave off it? So there's kind of two questions there.
I see the care of disabled and elderly and the care of the mentally ill is kind of, excuse my mixed metaphors, but they're kind of being set against each other. And this was the problem. This is how 400 beds got cut at Laguna Honda, even though skilled nursing beds are badly needed. The independent living community was told that Laguna Honda was a black hole for money and that these beds would be funded in the community. That was true only to a very partial extent. And it's true that no one wants to live in a nursing home if they don't have to, and that other sources should be funded. But there are people that have to live in nursing homes. And so one of the things is by playing a zero-sum game where we have to cut this service because this service will suffer, we are excluding and judging and rationing care. And it's bad.
I noticed Jessica Lehman's here and she may have some thoughts on this as well. Jessica, would you comment on this scarcity of resources issue, or do you feel that you can say something about that? Jessica Lehman is the Executive Director of Senior and Disability Action. I don't know if you're prepared.
Just say give her 10 minutes. She can't answer right now.
Okay. So we do have some questions in the chat. Michael, do you have any that are queued up, or should we just look at? I think there's plenty of response and question in the chat, like questions about the consultants. Are they really worth it? Jessica said there are plenty of programs and supports out there to support disabled people in the community, and but those programs may not be adequately funded. That needs to change. There is a lot of comments about the closing of the state mental hospitals. I hate to see us in the progressive community and those who care about elders being fighting people who need mental health services who might not be in our traditional nursing home population. It seems really pitting us against other people because of a failure that is systemic. It seems really unfair to me. And why should we fight over that? And we should be working together to make sure everybody gets taken care of. How can we do this? But we have a short-term problem with Laguna Honda. So I think it might be good to get some responses from, we've already had some from the panel on what can we do to make sure Laguna Honda does not get shut down? Can we stave it off? And I think the Board of Supervisors hearing the other day, a lot of the Board of Supervisors members did express outrage about this threat of shutdown. Jessica, are you ready to say something?
Sure. Thank you so much, Art. Good to see everybody. And thank you to the speakers for sharing great information. I don't know where to begin, but and I won't go on too long, but I really share the concern that was raised a minute ago about pitting groups against each other. And back in 2000, when there was talk of rebuilding Laguna Honda, there was a huge rift that 22 years later has still not been fully repaired between organized labor and disability communities. And it was a national issue that Laguna Honda has been and still is the biggest skilled nursing facility in the country, and that institutionalization has been one of the primary issues for disability communities for the last, I don't know, 50, 60, 70 years since the disability rights movement really was born. And the issue is that there are so many different ways that disabled people of all kinds, mental health disabilities, intellectual and developmental disabilities, physical disabilities, et cetera, including older people with disabilities, right, have been put into all different kinds of institutions. And, you know, I think we're not just talking about skilled nursing facilities, we're talking about mental institutions, we're talking about prisons and jails, and we have this ongoing issue. We have had a huge push to expand conservatorship in San Francisco and around California and around the country, which is the same thing about taking away people's rights. And the reality is, you know, I think Dr. Palmer was saying that nobody wants to go into an institution, including a nursing facility, no matter how good it is, right? Nobody wants that. If somebody here says, I would love to live in a nursing facility someday, please say so, but it's just not the reality. And I'm not saying that
so.
You want to be in a nursing facility someday?
I just think it's important to point out that in public health, sometimes there are things that are required, and other times it's helpful. My father is demented and in a nursing home now, and that's because we have the resources to pay for it, even though he doesn't have a skilled nursing need. Because we have the resources for it, it's a safe place for him. There would be nowhere else where he could get the care than in this private nursing home in Mill Valley. So I'm aware of, and I agree that institutions shouldn't be relied upon. And I know that there's a debate about that. I'm just saying that I'm somebody that believes that sometimes institutions can be helpful. We need to have them because until everybody can be supported at home, I don't want to be played against each other that way either.
Absolutely. And I started to say that I am not saying that we can or should get rid of them all, right? That, you know, but it's really about looking at what do people want and what are the options, right? If the problem is that people don't have a lot of options to get their needs met, then we need to look at that problem together. And there's a lot of comments going on in the chat. Thanks for all the comments. And, you know, so I should have also said, many of you know that I'm a disabled person myself. I've used a wheelchair my whole life. I rely on attendants to get me out of bed in the morning, you know, help me get in bed at night. And if I didn't have attendants, and if I didn't have a job to help pay for those attendants or other supports, I would be in an institution, right? And the lack of options in our community is not okay. And we have to acknowledge in the middle of all of this, right, that even while we're saying that Laguna Honda can't close immediately, we also have to acknowledge that there are people there that don't need to be there. And that's a problem, that they don't have other options. And I'm extremely concerned that not only is that happening, but that I'm seeing a repeat of some of the same divisiveness that I've seen over the last 20 years. I don't want the senior community and the disability community to be on opposite sides of this. I don't think we need to be, but that means we have to have a nuanced conversation about how do we have multiple options in the community. It can't be just keep it open or bust, right? It needs to be, how do we make sure that everyone there gets what they need, right? Some in Laguna Honda when it's hopefully recertified, and some elsewhere. And I really hope that this is a place where we can figure out how to do that and really recognize the history and the pain and move forward together. Thank you.
That's great. Thanks, Jessica. We have another question from somebody here who's on an iPhone, and I don't have your name. Can you say your name and unmute yourself? Maybe in the opposite.
Hi, Sue Englander.
Oh,
Is
hi,
this
Sue.
Art?
Yes. Hi, Sue. Good to see you.
Hey. So, you know, one of the things I put up, you know, I'm both a former health caregiver and a historian. And historically, you know, public health generally has had to struggle because everybody thinks it's socialism. So once you even start to pick apart the needs within public health, it's a struggle. And, you know, we're seeing now the fallout from Reagan's governorship 60 years ago. But what we're also seeing historically since the 1910s is a stigma attached to public health. And the fact that it's a low priority in terms of funding, despite, you know, the fact that, as we saw with COVID, public health is desperately needed. And so I think, you know, we need to both see the forest and the trees. Laguna Honda is only a symptom of this chronic underfunding of public health generally. And we all within the public health community of needs, you know, drug, mental, long-term, you know, we need to really build a coalition and start working together so that we can't be divided up, you know, and as Jessica said, you know, you don't want seniors working against this disabled, and especially when I'm both senior and disabled. So there you go. So, you know, I'm wondering how people would respond to that.
Well, I think one of the things is in the younger disabled population, you've got some pretty strong fear of nursing homes. And so it's quite easy to split. And the first thing to do is to not be split. We know there's a shortage of nursing home beds in San Francisco. We know the population is aging. We know that in people with dementia who need 24/7, who are medically complex, there are very few families who have the resources to take care of that person at home under any situation. And I think this is going to be an ongoing problem, because when I say zero-sum game, I mean, basically the community is told there's only so much money, and if you fund this, you can't fund this, and people bite. I mean, you have to say, no, we will take care of everyone the way they need to be taken care of, and you need to fund it. That's the approach that we need to have. Not arguing about you know, who deserves a nursing home bed and who deserves to be taken care of at home. Everyone deserves to be taken care of where their needs can be met.
Yeah, where their needs can be met is the key issue. So we need to identify those patients that are not being cared for properly at Laguna Honda and see if they can develop a specialized program either within Laguna Honda or outside of Laguna Honda, a new program for people with medical and psychiatric and substance abuse issues, so that Laguna Honda's license isn't jeopardized by shoehorning patients in there that they can't really manage. So we need some new programs. And, you know, we have the mental health SF initiative that Supervisor Hillary Ronan and Matt Haney, I think, sponsored. And that's coming around, and maybe that's something that can be used to provide some services for these difficult to manage patients that got Laguna Honda into trouble.
Sasha, you want to add anything before we go to our next question or comment?
No, I think we should let people ask more questions. Thanks.
Okay, go ahead, Betty. You're next up. Unmute yourself. There you go.
Okay, thank you. I like the way the discussion is going right now, where we're trying to talk about working together for the needs of all the people. And I did want to bring up, I listened in on the hearing about Laguna Honda at the Board of Supervisors meeting last week. And as someone commented, the board was in shock, but at the same time offered no solutions. But I wanted to bring up that the interim CEO, Roland Pickens, mentioned or reported that they have to assess every patient because of this requirement that they have to leave, which of course we know is impossible about the leaving part or being transferred. But the assessment part, in a way, is something that may be good that came out of this. He said at the time there were about 300 or so that had been assessed as of that day, last Tuesday. And he found a certain, or they, whoever was doing the assessment, of course, all of that has to be looked into, but I think he said about 80 that really did not, according to their assessment, did not need to be in Laguna Honda. So when they finish the assessment, they may find 160 people or, you know, whatever number. And that at least helps us, maybe the community, the healthcare community and Laguna Honda healthcare community, to know, well, maybe we should find a different place for these people. Now that comes the whole problem of where. And but we have to work together to get the money to provide the best place for people in buildings that are not institutions, are housing, and that have supportive services for their particular needs. That would include in-home support people coming to assist. But at least we need to look at that, and it's actually happening in a sense at Laguna Honda. They're being required to do these assessments. So I just wanted to bring that part up. That's all. And if anybody had any comment of the Dr. Kerr or Dr. Palmer, anybody.
Okay, panel.
Well, you know, the more patients that Laguna Honda discharges, the less revenue it gets. So this whole process, not being able to admit patients and having to discharge patients, is contracting its revenue base. There's going to be more fiscal problems at the end of this. But to avoid a repeat, they have to develop new programs to take care of these hard to manage patients.
But by not admitting the real problem, by minimizing it, that doesn't make a very good prognosis.
Right.
Well, in the meantime, hospitals keep on sending people out of county. So, you know, for rehabilitation, so that can be fixed, right? If they pressure General Hospital, whoever needs to be pressured into admitting people from other hospitals.
Good point. I'd like to propose a break unless there's an objection from Teresa or in the board for 5 minutes. And after we come back, could we spend just a few minutes? Maybe you'll think about it during the break. What demands should we be making? There's been a lot of good ideas brought up here. Maybe there's a need for another meeting to really organize a response from this community. But usually I take a break at about the 1 hour point, and for 5 minutes, is that okay? Or if people feel that's all right? Think about what demands should we be making? Maybe we can wrap it up with that in the time, maybe the last 15 minutes before we break at 2:30 for the internal Great Panther meeting. Thank you. We'll resume in 5 minutes. Okay, we're at the end of our 5-minute break, I think, judging by the clock. It just want to make a brief statement that power does not yield without a demand. So I think we should make demands, or at least put our thinking caps on and come up with some ideas for coming up with a consensus set of solutions that we can rally around. We could start doing that today. We could have another follow-up meeting to this one. I've encouraged people to put their ideas in the chat. We have about 15 minutes left before we're going to break for our internal meeting. So we can continue to have this discussion. If you have a question or comment, put your hand up or put something in the chat. Okay, Derek, go ahead.
Before making a demand, we have to know what the problem is. What is the situation? And it's very hard to tell just from the press releases from the Department of Public Health. I got a lot of information from the state on the findings of the surveys, and they were much worse than what the Department of Public Health mentioned. So one demand could be for transparency, that the department or Laguna Honda or the Public Health Department should have a website that gives the reports of all the surveys, what are the findings, the recommendations of the consultants that we're paying $5 million for, those should be made public. I had to put in a records request to get a copy, and one of them, they're still not releasing. So we don't have enough transparency to know what the problem and what the demand should be. So one demand could be for transparency.
Thank you. Sasha, you have your hand up. Unmute yourself, please.
Yes. So my suggestion is to demand that the Gray Panthers or other organizations demand that that both these highly paid private consultants, as well as management and administration of Laguna Honda and the Department of Public Health, listen to what we see as the problems are, and to make our demands to them directly to them, not going through the Board of Supervisors, but to make it a direct thing saying, we're not going to let you shut this place unless you can come up with a plan that works for the families of every single person here, because we have to have it. And that is the demand, but we also need to have some say-so in this. And part of the problem I would like to add is that there's what we're having is that there's the effects of systemic racism, as well as all the other isms are coming at old and disabled people at Laguna Honda in particular. And unfortunately, within the healthcare world, as a nurse, I can say that that long-term care is considered less glamorous, in addition to not being well funded. So it's the people that need help the most are those that get the least, and we need to make sure that the people in charge know that they have to do something about that. They can't just say, well, we can't do anything about it because of funding, because I believe that that is not true. I believe that there's enough resources in this city to be able to do it, and to do it right, and much better than the minimum that's needed. Mitch Katz, all those years ago, I'm jumping on him again, when they shut down some of the acute psychiatric beds at San Francisco General Hospital, thus contributing to more and more people on the street who are psychotic. When he was asked about that, when they said, well, how can you shut down the psychiatric beds when there's so few in the city already for the people that need it? And his response was very telling to me, because he said, well, it's true that there's not enough there's not enough beds for the acutely psychiatrically ill patients, but we don't have enough room for the people that want help. So what he was sharing was because he was in the acute care world as an AIDS doctor, he didn't think that people that are psychiatrically ill, that they don't want help. So that's one of the things that we have to fight against and tell them that that is a load of bull. I have never had a patient that didn't want to have help. If they've got medical problems and psychiatric problems, they want help. If they need to be institutionalized because they're threatening to kill somebody or themselves, then they deserve help. If that's the case, you don't just tell people like, well, you don't want help, so you can go ahead and kill yourself. That is not a civic society. So I think we need to be making it very clear that whether you call it skilled nursing or not unskilled nursing, we have to help our community. That's why we have local government.
Okay, thank you, Sasha. How about Michael, and then have the presenters have 2 or 3 minutes to sum up what they think we should be doing. Michael, go ahead. You're muted. No, you're unmuted. Go ahead.
I didn't have my hand up, Art.
Okay, so we're at 2:20. Would the panelists like, we maybe ending with Sasha because he just spoke. Would you panelists like to make a sum up of the most important things you think that we have learned today, or that you want to emphasize, or even better, where do we go from here?
David, can I I'll have you.
Okay, I can speak. If we don't have an honest discussion about how this happened, we can't come up with honest solutions. So I second Derek in saying the public needs to see in detail the reports of the consultants and the reports of the infractions from the state. You'll see some of them in Derek's columns for the West Side Observer, and we've given you a link to that. But we individually can't do freedom of information requests. And really, the Department of Health is getting up at the Board of Supervisors in line. And so we need, first of all, an honest discussion about where the gaps in services are, and then we need those services.
Okay. Derek, do you want to make any final statement?
I just think this discussion is very helpful. People just need to be aware of what's going on, and this kind of meeting does that. I don't have an immediate solution. I think that Laguna Honda or the Department of Public Health need to look at what the inspectors are upset about and fix those problems. And that's probably going to involve new programs or more specialized programs. But they're the ones who can deal with that. It's very hard for the community. But I think if the community is aware of what's going on, that's the first step.
Okay, Sasha, you want to make your final statement, then I'll make a statement.
So I'm afraid that that other than speaking out forcefully, saying that we demand that the federal government continue to allow it to remain open and for our communities, that we need to do something more than that, and it needs to be more than a list of everything that went wrong. So I think I respectfully disagree, because I think there's so much that's wrong anyway, that what that could lead to is people saying, well, if the place sucks so bad and administration can't do it, then we don't want to pay for it as taxpayers, so just shut it down. That's what I'm afraid could happen. So instead, I think providing, focusing on some of the bad things that have happened would be something that, provide a list to people of what's gone wrong, and then to come up with solutions that include acknowledgement to some extent, whatever extent possible, by the successive administrations of DPH that have done disastrous things, that have harmed people and led us to this situation. If they could say something, but that, I know that's something that it took a lawsuit for Dr. Kerr to be recognized that he was mistreated. And I think the same thing has happened, that people don't trust when people come along and say, oh, we really want to make it good this time. Nobody, in my experience, who works for the health department believes it anymore, because people say, oh, we want there to be equity. But then what they do is they're just looking out for themselves. The corruption is very painful and awful. So if there could be some kind of acknowledgement made that we have really screwed up on some of these things, we need to do better. We need to do better personally, and for there to be some accountability would be something that would be helpful, I think.
Thank you, Sasha. We only have about, a couple of minutes left. I would like to propose that we have a follow-up meeting. If the people in this room, in this Zoom room, agree, I think the organizations who we represent should be asked to participate. That would include the Gray Panthers, SDA, and others, maybe Senior Power, whatever organization you belong to. Sasha, it could be a caucus of your union or some subset of your coworkers. Would it be possible to have a follow-up meeting where we move things forward with coming up with a set of solutions or demands that we could prioritize and agree upon? Does that make sense?
Yeah, it's good.
Okay, so if you're interested, would you put your name in the chat? And that's all I have to propose. If there are other ideas, I'm certainly I'm just facilitating this meeting at this point, this Q&A. So I encourage you, if you want to save Laguna Honda, it can't end at this meeting with some talk. It's got to involve some action and based on organizing. So if people will put their names in the chat, then that can happen. I'm going to say that I want to thank the speakers today.
Thank you.
The organizer, Teresa Palmer, Dr. Palmer, Derek Carr for his journalism and his thoughts, and Sasha Cutler, who is a worker on the forefront of standing up and sharing his observations and his ideas and his activism. Thank you all for being here to share your ideas with us. And